Okay, this video I'm going to talk about electrical currents in dentistry. This is a relatively specialized topic, so unless you're interested in teeth or electricity in the body, you're not going to want to hear this. But if you're interested at all in potentially having a tooth removed or having dental work, or have somebody in your family who you want to understand the relationship between dentistry, dental fillings, and disease, this is going to be quite interesting. This guy right here is Hal Huggins. He's probably the greatest dentist who ever lived, him and Weston Price. And I'm also going to tell you, everybody's, not really standing up to the current billionaire perverts are trying to what side, Western civilization, get rid of all the white Christian men. But I'm going to tell you, I've studied a ton of science, a ton of medicine, and most of the geniuses are these old white Christian men or Jewish guys. That's the majority of them. There's plenty of super high IQ people from all the different ethnic groups, male and female. But there's a personality issue involved too. It has to be somebody who simply puts their curiosity above their money, above their personal life. Some guy who says, this is more important to me than anything else. And most people are not willing to do that. Most women, their kid's the most important thing. They're going to take care of their kid. They're not going to stay around late after work doing research. They're going to go home to their kid, to their family, all right? Or there's other people who their goal is to make a lot of money, so they use their brain to make money. But I'm telling you, it's guys like this who sit around just because they're curious and try to figure things out who make the biggest discoveries. So this guy, Hal Huggins, he'd seen an article somewhere that there was electricity coming off teeth, and he read, you have two different types of metal. They'll have a different charge on them, different electrical properties. The saliva is a conductor, and you start running an electrical current between two different fillings. Let's say a silver filling with amalgam mercury in it and a gold filling. So he started measuring these things. And then he started taking fillings out on people who had diseases who they thought the filling was related to the disease. And he was noticing he had about a 10% cure rate or dramatic improvement in the patient. He couldn't understand why. So I'll show you a little bit more about this electrical current business because I thought it was rather interesting. So you've got something called cathode and an anode. Here, let me shrink myself out of the way here. And the anode is positively charged, but what you want to know is that the anions are negatively charged. So the anions being negatively charged will flow towards the positive charge over here. And an means sort of to go up. Cat means like kata, to go down. That comes, think about, classical literature. Katabasis was to travel down into Hades. Like remember Odysseus, the adventures of Odysseus. He went down into Hades to speak with the ancient Greek, blind prophet Tiresias for advice. There's things like that. Or Aeneas going down into hell. That's the catabasis scene. Dante, catabasis, okay? So that reminds you of going down. And here's the cathode. It's negatively charged. So the cations, I remember a cation is positively charged because a cat purrs. And it's going to go towards the cathode. Anyways, you'll have a flow of electrical current. Okay, so now here's what you see in the mouth. You'll have flow, let's say, from one type of metal in the mouth like gold to another, a silver filling, which is really a mercury filling. And you can measure that. You can measure intrinsic charge on the different dental metals. And the relevance of all this was this guy, Hal Huggins, for like a year and a half, he just measured every single the metal in every single patient's mouth, the charge of it, and whether or not current was flowing, and what he could tell about the current. And he was trying to figure out a pattern. He had no idea what he was doing. He just wanted to obtain all the data, and then he started to analyze the data of what patients were cured of multiple sclerosis or other illnesses when he removed it. And then he also became interested in acupuncture meridians, and those did seem to have some correlation with healing. If you had a tooth along the line of an acupuncture meridian and they had a disease that was sort of bizarre, unexplained, and they would remove that filling, the acupuncture meridian associated arthritis or whatever the problem was would often heal. Okay. So then where this becomes relevant is, let's say you have a patient who's got multiple amalgam fillings and multiple sclerosis. And what he was trying to figure out is, does it matter what is the order in which he removes these things? And so he was mapping out the currents, mapping out the intrinsic charges of the different fillings. And what he found was he has to always do the negative filling first. If he removed the quadrant of the mouth, you have 4 quadrants of the mouth. You have upper right, upper left. You have lower right, lower left. And basically whatever quadrant contained the most negatively charged tooth, he would remove all the amalgams from that quadrant. And he found that yielded about a 40% overall response rate in comparison to if he just randomly removed these amalgam fillings. And he doesn't even know why it worked, but other people have repeated his findings. And I'm just telling you, this is a brilliant thing, and it's a very interesting thing. And it also teaches another point. You don't ever want two different types of metal in your mouth, because the difference in their general electrical properties will yield increased electrical current, and that'll cause the increase in electrical current. The more current there is, the more rapidly the amalgam mercury vaporizes and can potentially cause toxicity for the patient. It makes it harder for them to keep up with it. Because what you want to do is try to keep your excretion rate above your intake rate to the extent that's possible. For example, by sweating, by urine, by defecation, etc. By exhalation. It's better to breathe through the mouth than the nose. Anyways, I thought this was rather interesting. I'll have the link in the description below because I thought this was really interesting. He's got a great lecture. The lecture is really good.